Since 2018, this conference has begun with a report on the results from the Cooperative Benchmarking Survey. The survey is conducted each year by the ICA Group, and it helps us understand how home care cooperatives compare with one another, and also the home care industry generally. Because we now have 3 years of survey data, we are beginning to be able to see trends over time. The participation of cooperatives in this survey is invaluable, and we know that it takes time to complete this survey and that you're very busy. So we really appreciate all the participation that we've had from cooperatives over the years. The value of this data helps us quantify the co-op advantage in home care, as well as helps us identify where we need to focus and up our game. So thank you again, and we will be including gift certificates for co-ops that completed the survey in a package that will be sent out after this meeting, and it's so that you can buy yourself a lunch, and the people from your co-op who participated in this conference can have a treat on CDF for your participation. With that, I want to introduce Iwona Matczuk from the ICA Group, who is going to talk about the benchmarking survey. So thank you, Iwona.
Great, thank you, Leslie, and thanks for having me. Again, like Leslie said, my name is Iwona Matczuk. I'm with the ICA Group. I know a handful of you probably will get to know more of you in the next year, so I'm excited to present these today. And you know, I really hope that everyone's as excited as I am to carve out time this week to learn and celebrate, you know, home care cooperatives and their amazing accomplishments. And while 2019 seems like a lifetime ago, I think you'll really enjoy taking the next 30 minutes to celebrate and reflect on the accomplishments of our dedicated caregivers and administrators. So first, I just really want to start by attempting and to provide all of you the acknowledgement you deserve for getting through 2020. You all weathered a storm that many could not. And in many ways, home care was finally recognized for the crucial services it provides to our society. And while we're still very much dealing with the effects of COVID, you know, people are still looking for expensive PPE, staff is still at risk of getting sick, our clients are more vulnerable, and now we're trying to find vaccines for caregivers. We shouldn't really forget the mountains each of you have climbed in this last year. And I just really want to take this moment to say thank you for taking care of our communities. Since our last conference in November 2019, we had some exciting developments in the sector. Soaring Independent in Madison, Wisconsin, Ridgeline in Port Angeles, Washington, and A Touch of TLC in Cincinnati, Ohio have all launched and began serving clients. And I think each and every one of you can remember your early days of operation, and you know the feeling of serving your first client. And so I'd like to, you know, just take this moment to really uplift this very real accomplishment that takes a lot of hard work. So first, we're just going to really set the stage about the survey, really provide some context, and then launch into the results and analysis. So the 2020 survey, which features data from calendar year 2019, had 13 of the 14 total cooperatives respond. And of those 13, 11 were in operation and serving clients for the full 2019 calendar year. And then of those 11, we were able to make apples to apples comparisons between 10 of those cooperatives. It's important to note that in order to properly capture historical trends and significant achievements, we use the same survey format as last year. The key difference for 2020's survey, which many of you probably didn't notice because that section wasn't for you, was that we included a more robust section for cooperatives that are still in their startup phases so that we could get a better picture of the challenges and opportunities for newer co-ops. In 2019, 11 cooperatives were in operation for the entire calendar year 19, like I said, 7 of which were private pay only. 7 of which were private pay only. 1 was private pay and served Veterans Affairs through public payers, and 3 were primarily public pay. For this analysis that is to come, only information from the 10 cooperatives was used. Excuse me. And like Leslie said, we know the benchmark serving is a pain. We know it takes a lot of time, but I can't stress enough how worth it is. At the individual cooperative level, the data you submit is critical to understanding and monitoring the health of your cooperative. In addition, we hope that you and your cooperative have been able to actively use the data you submit to understand the co-op better, drive informed decisions and market your cooperative difference and how you compare. The benchmarking data does the same thing on a larger level. We want to know how each of you, as well as the sector as a whole, is progressing. This helps us develop tools and resources that either reinforce or remedy what is happening. And lastly, it really just allows us time in a space like here to celebrate our collective successes and impact with the larger home care industry and world. And just anecdotally, I want to add in that in the 2019 benchmarking report published on ICA and CDF's website last year piqued a lot of interest from external partners who had never heard or considered the cooperative model for their home care projects before. Great, so now let's jump into some results. I think everybody will be really happy and have a lot of great kind of discussion to talk about. So in calendar year 2019, home care cooperatives employed almost 350 more individuals, a promising upward trend that it was a product of each of the 10 cooperatives, either maintaining or increasing their staff. So this has been our largest count of caregivers to date. Just like in 2018, the home care cooperative sector generated over 76 million in annual revenues, 94% of which came from public payers, primarily Medicaid. And then in 2019, there was a slight decrease in revenue from public payers, but this was largely offset by increases in private pay revenues, which we'll actually dive a little deeper into in the next few slides. Overall, the loss wasn't that significant, less than 1%, but considering that so many cooperatives saw increases in staff, we should have seen an increase in revenues to support that growth. This is a trend that we'll be working to understand a little bit more. Interestingly, while caregiver hires have been trending up, client hours have been consistently trending down. It's likely that this is correlated with the continued decline in publicly funded hours, or publicly funded client hours, and we'll be investigating this trend as well. So in 2019, we served almost 3 million client hours. Before we lay the land on in order to lay the land on how something like this happens, the 8% decrease in sector revenues was primarily driven by a decrease in public pay hours, the effects of which were largely offset by the 10% increase in private pay revenues. Overall, 5 co-ops saw increases in revenues, while 5 experienced decreases from 2019. This is the exact opposite of what we saw in 2018, where private pay revenues went down and public pay went up. And then even though client hours decreased, we thought it was important to just like stop and take a moment to understand the effects that private pay has on the bottom line. So the effects of private pay on the sector is absolutely something that can be applied on a granular level at your cooperative. The left side of the screen is representative of public pay, and that's demonstrated by the $22 average hourly rate for public pay payers. And then the right side of the screen is private pay. So left is public, right is private pay, and that average is about $30 an hour. And so as you can see on the left side of the screen, client hours went down by about 225,000 hours in 2019. And that correlated to a loss of $350,000 in revenue, 0.5%, just a kind of a drop in the bucket. On the right side, client hours went up by only 7,000, or private pay client hours went up by 7,000, and that correlated to $270,000 in revenues. So really, this is just a demonstration of the marginal difference between private pay and public pay hours and revenue on the business and the sector as a whole. So as we start to collect more data year over year, what we call the cooperative difference is going to vary at different data points. Some components of the next slides have trended upwards since last year, while others have trended downward. So that's to be expected, and we'll most likely see that again and again. Moving to caregiver turnover, home care cooperatives increased their lead by 2 points, dropping from 38% to 36% in 2019. Overall, this is great. And one thing to note, though, is that the industry as a whole dropped 18 points from 82 to 64%. So while turnover for home care cooperatives is still significantly lower than the larger industry, the more substantial lead we saw in 2018 is starting to narrow. And so this is really something that we need to continue to monitor and find solutions for as a sector. Among the cooperatives, the turnover ranges spanned from 7% at the low end to 50%, 56% at the high end. And even compared at the high end to the, it's still lower than the industry's 62% turnover rate, about 10 points less, but not by much. And so the key takeaway here is that in order to maintain our competitive advantage against the sector, we need to make retention a top priority moving forward. Ownership at home care co-ops increased minimally from 47 to 48% overall. But interestingly, we saw a significant downtrend in ownership amongst the smaller cooperatives, which we consider to be 100 or less employees. That went down from 72% to 59%. And this was surprising for us this year, and something we'll work to better understand in the coming year and hopefully find some solutions for. The overall tenure for the sector increased from 16 to 17 months, but most substantially, the median tenure rate for co-ops that have been in operation for at least 5 years rose from 24 to 34 months. Unfortunately, this year, Home Care Pulse, which is the industry data set that we use to get comparative data from, is discontinued measuring median caregiver tenure. So unfortunately, we don't have industry comparisons this year. They replaced their median tenure data point with revenue per caregiver employee, unfortunately. Tenure in particular is one of those data points where you really have to look behind the numbers. And while median at home care cooperatives is only 1 month more than the non-cooperative agencies, the range at home care cooperatives is as low as 9 months to as high as over 5 years. And so I just really want to stress that high tenure is a success achieved by both small and large cooperatives. And there are many factors that influence caregiver tenure. The one thing I think worth zeroing in on here is wages and benefits. Home Care Pulse demonstrated in their most recent benchmarking report that agencies with the lowest wage, either $10.49 or less, have the highest turnover rate, and that's about 86%. And those that pay the most, which is about $14.50 more or more, have the lowest turnover rates of 54%. So something definitely worth thinking about. And before I move into the next slide about wages, I just need to interrupt to note some important changes to the methods and how we calculate the cooperative difference in wages. The Bureau of Labor and Statistics, which is the central location in the US for all employment data, discontinued separating out home health aides and personal care aide wages in their reporting. In the past, because of this delineation, we've been able to calculate weighted wage averages for each of these positions, seeing as that we all know that they're paid different amounts and have different training requirements. I think we all know the difference between an HHA and a PCA. However, starting in 2019, the Bureau of Labor and Statistics has merged those two positions into one category. So last year we reported that on average, cooperatives pay 54 cents more per hour than their non-cooperative counterparts in those same states. When I redid those calculations using this year's method, which combines the HHA and PCA wages, that number only changed to 50 cents. So we were still within the mark, and that didn't really skew any of our findings significantly. Great. And so with that, we'll continue. In 2019, home care cooperatives paid a whopping $1.93 more than their non-cooperative counterparts. This is because each of the cooperatives either raised or maintained their wages in 2019, and 90% of the cooperatives outperformed their state's average wage. So this is really just a great job, everyone, and I think this is definitely a moment to celebrate, and really is just representative of the sector being responsive to not just the market, but the needs of the caregivers. And real quickly, I want to point out that last year, this graphic was actually flipped, with home care cooperatives representing that shorter arrow on top. In 2019, the industry in those 7 states where our cooperatives reside only grew their wages by an average of 31 cents. In 2018, that had been 44 cents, which was only marginally better. The cooperatives really knocked it out of the park in 2019 by increasing their wages by an average of $1.06. It really is just an amazing showing after last year's 22-cent increase. Again, congrats everyone. This is really a collective achievement, and particularly where I'm sad that we can't all be in the same room to celebrate this. Looking more deeply behind the numbers, 6 cooperatives increased their wages from the previous year, while the rest really stayed steady. And I think the key takeaway from these amazing metrics is that in 2019, cooperatives were, again, responsive to their caregiver needs and the overarching trends in the industry in order to be and remain competitive employers. Finally, moving into training, what we consider the 4th pillar of the cooperative difference. In 2019, we found that 9 out of the 10 cooperatives go above and beyond the state minimum training requirements, demonstrating a collective commitment to providing a stronger and more supported workforce. Furthermore, 7 of those cooperatives pay for training time, which is really just a reciprocation of caregivers' commitment to the cooperative. In terms of professional advancement, participating in national events such as the Home Care Conference, as well as identifying local opportunities and stakeholders, cooperatives can work to move the needle for better caregiving jobs on multiple fronts. We see this in practice with 9 out of the 10 cooperatives providing speaking engagement and advocacy opportunities to their caregivers. Additionally, something that can be done internally and similarly breeds commitment from staff is providing opportunities for caregivers and other staff to build on their administrative and leadership skills. This helps continue being able to support the cooperative in new ways. And before COVID, half of the cooperatives offered opportunities to decrease the isolation often experienced in caregiving through team building and social events. while 7 of the 10 co-ops offer some sort of peer mentorship, coaching, or shadowing programs to support new caregivers and bring them securely into the fold. Additionally, 5 cooperatives offer short-term financial supports for personal emergencies, demonstrating the understanding that caregivers really live complex lives that can be quickly disrupted. Offering financial assistance in whatever nominal form helps caregivers continue doing their jobs and providing for their families. And finally, word of mouth was ranked #1 client recruitment channel by all 10 cooperatives, demonstrating yet again that the level of care and companionship cooperatives provide is shared and celebrated by clients. And then recruiting caregivers, 7 of the 10 cooperatives reported that caregiver referrals are their #1 recruitment source, showing that cooperatives really are just resourceful and use the tools around them to get where they need to go. And really, we're just going to look ahead to some challenges and opportunities. As Leslie said, we really want to know how we're going to address these and what we can do to kind of plan ahead. So you know the challenges better than anyone. This is your lived experience, but I do think it's helpful to report back on them, both to understand that you're not alone and your challenges are felt by the sector and the industry as a whole. Unsurprisingly, client acquisition and caregiver recruitment were tied as the #1 business challenge amongst all the co-ops, a constant struggle, not just for home care cooperatives, but the sector as a whole. I can't stress that enough. The all too well-known seesaw of like attracting new caregivers, but then struggling to find enough client hours for those caregivers to stay on, or getting a new client, but then struggling to have a caregiver to fill those hours and retain those clients just is a constant. And both sides are constantly fluctuating. There never seems to be any respite. And for like even worse, both are very much dependent on the #1 operations challenge of marketing and sales. So I just want to take a moment here to talk a little bit about what we're doing here at ICA. And we're working closely with a few cooperatives now to test our assumptions around some tools that would expedite and manage these processes in a more streamlined manner through the secondary cooperative. We'll be really excited to present on some of those tools with the broader sector within the year. And we're hoping that with these more manageable internal processes, cooperatives can spend more time centering their governance challenges, which are all too often easily fall to the wayside. And interestingly, only 3 of the 10 cooperatives use SEO to recruit clients, and only 1 of each of the co-ops uses social media or lead sites. Again, part of the project I mentioned in the last slide is piloting a marketing cohort next month with a few co-ops to find ways for each co-op's website to work harder, work smarter, and work better for the needs of the co-op. And that's not to say what's happening now isn't working. It's a yes and equation, really. Co-ops should continue to leverage the cooperative difference to attract new caregivers and clients, continue addressing caregiver needs head on, and in both in their job postings and scheduling conflicts, and most importantly, to try new things. We're all here to learn and share best practices, and courage gets rewarded here. And finally, I just want to end on this. We created this word cloud based on the cooperative's answers to the question of what are 3 adjectives you would use to describe your cooperative? And committed, compassionate, and adaptable were the top 3 answers. And this word cloud really just reflects the co-op's hard work back at them. So I'm happy to share this. I think this should be kind of visible and seen wherever we can show it. And it's just really a lovely snapshot of what we have here at the Home Care Co-op. So yeah, thank you. And I'm happy to take any questions.
Well, that was terrific. Thank you, Iwona. We have a number of questions, so let's start out. What do caregivers say as their major reasons for either staying in their present job or leaving?
I think we didn't ask that explicitly in the benchmarking survey this year, but we do find that wage appreciation and opportunities for growth and advancement are kind of the top three reasons people stay.
Great. And then a follow-up of that is, and you may not be able to answer that, what percentage of those who have left accepted better paying jobs at other organizations, or do we know?
We don't know that. I could do some general research around the sector as a whole, but we wouldn't know that amongst our own cooperatives. Yeah.
Great.
It's a great data point, though.
Yeah, wouldn't that be nice to know?
If anyone wants to start keeping track of that, highly recommend. Would love to see that.
Is there an ask for employee engagement or satisfaction scores for cooperatives?
No. So the benchmarking survey really goes out to the administrators, and they speak on behalf of the co-op as a whole and its operations and functions. So that's a great suggestion in terms of really expanding out to getting some caregiver feedback, and that we could potentially facilitate that through each of the cooperatives. But for the most part, we don't have caregiver satisfaction.
Culture, let's see, what did they get rid of? Why did they get rid of, I think this is referring to the co-op pulse. Why did they get rid of median tenure? Seems like a valuable data point.
Agreed. And so I think there's just probably various reasons that influence tenure, and it's hard to really kind of pinpoint reasons for tenure of why some do better than others. So they've really reconfigured that to talk about like how much money an employee can bring in during their tenure, and kind of quantify it in a different way.
Are co-ops trending to begin employing frontline HHC or PCAs and licensed caregivers?
So I think I know what that question is alluding to. So whoever asked it, if this doesn't answer your question, I'm happy to focus. So at current, all of our cooperatives really only employ PCAs. There's no HHAs at any of the cooperatives, except for I believe Home Care Associates does. But I think that training is very similar to PCAs. And so licensing really is state-based. I believe all of our cooperatives, though, are licensed in the states that they operate in.
Are there details in where the word of mouth is coming from? And is it clients telling their friends and families or caregivers?
I think it's yes, and I think word of mouth is hard to track. And I think, happy clients often talk to their friends and family. I think disgruntled clients also talk to their friends and family as well. So the fact that our word of mouth is actually trending positively is really a great indication of the care that the sector provides. And then additionally, satisfied, happy caregivers tell their friends and family as well that they're employed by somebody who really takes into account their schedule, their needs, their specific life situations. So I think it really kind of goes in both directions.
Those are the questions in the chat. I had an additional question. The decrease in ownership numbers for smaller cooperatives, is there any correlation there with growth in size? So is
there could be
like probationary period that
there could be? Yeah, that's a great point. And that's one of those, I think that's one of those data points, as I mentioned, that will kind of like fluctuate year over year. I think there's a bit of a lag in that data point kind of presenting itself. And similarly with wages, it's all about like how quickly responsive the cooperatives are to the market. So last year we saw the industry really respond to wage increases, and this year we saw the co-ops really respond to wage increases. And so it might be a bit of a leapfrog year over year, and similarly with ownership for those smaller cooperatives as well.
And I did, we're at our time, but I did have one other question.
Sure.
And since I'm the moderator, I'm going to ask it. Any indication of what the industry as a whole, the non-cooperative industry, is doing to improve their retention?
Oh, they're doing a lot. There's a lot of webinars always about, providing different, upskilling, ways of appreciation. There's a million different ways of avoiding saying raising wages and providing benefits. And, they say all of those. So, yeah, I think they're all really trying to find those sweet spots. And I think, we'll find more and more that wages go up, benefits are hopefully, really becoming more of a norm as we again face this huge caregiver crisis and this huge demand and need for caregivers. I think the industry is really starting to wise up, and that is only great for us and great for everyone else as well.
Well, this is always my favorite presentation of the conference. So thank you again, Iwona, for all your good work on that.
And there'll be a report coming with this following up next month or so.
And that report is so valuable for us in working with policymakers. And I really appreciate all your work on that. So thank you very much.